You're listening to Healing Voices Project, where we share stories and the latest information from people who fight addiction every day. I'm Mike Torville, your host and author of Voices from the Fallen. Thank you for listening, for following, and most of all, for sharing with people you care about. Make your voice count too. Hello everybody again, thanks for joining us at Healing Voices Project. We're glad to have you back, and today, as usual, we have two guests from Northstar Recovery, Kayla and Haley. Both of you, thanks for coming.
Thanks for having us.
Sure. Now, Kayla Regali is the Community Outreach Manager at Northstar Recovery, which has two locations, one in Southborough and one in West Springfield. And Kayla has lots of experience in collaborating with community partners to help find resources for individuals and families struggling with substance use disorder.
Yeah.
And but you've helped many people free themselves from addiction over the years. How long have you been in the business now, Kayla?
So I'm going on almost 5 years.
5 years.
Yep.
Okay. Wow.
Yep.
And also we have Haley Pepin, who is a licensed independent clinical social worker who works at Northstar Recovery also, of course. And you're the clinical director, and also you oversee the new West Springfield location, correct?
Correct.
Yep. In addition to your master's degree in social work, you are EMDR certified, and you have extensive experience treating those with substance use and mental health issues. And if people don't know what EMDR is, please stay with us, because I think you're going to find this a very interesting discussion about EMDR, which is eye movement desensitization and reprocessing therapy. Well, just saying that out loud is a little mouthful, but we'll stick with EMDR. So Kayla and Haley, thanks for both joining us. You guys got some great experience and great things to talk about today. So let's talk about Northstar and what you guys are doing at Northstar, your roles and how things are going and what you're doing on kind of on an everyday basis. And then we'll dive into the EMDR, okay? So I guess we can start with you, Kayla.
Yeah. So at Northstar, we provide outpatient support. It's kind of a part of the, people will come in and just do outpatient, but really when you look at substance use disorder as a whole, what makes people most successful in their recovery is really going through like a full continuum of care, of treatment. Just kind of as we're in this time where we're breaking the stigma of substance use disorder, more people are coming out. A lot of people suffer from it. It's just really important to stick with a treatment, because you might relapse a few times, and that's really part of the process. So sometimes people get discouraged. So it's really important to, if you go to detox or you go inpatient, once you get out, there should really be some support in place and an aftercare plan.
And in Northstar, you're inpatient and outpatient, or just strictly outpatient?
So we're strictly outpatient.
Yeah.
So we work with a lot of community partners that provide inpatient services, and the goal is for when people discharge and get back home, we're there to help them sustain long-term recovery. And so we provide day programming. We also provide evenings. So the goal is to, if people are taking time to focus on their recovery, we're there for that full time. But then as they integrate back into regular life, we can be there to support them too. Because if you're coming out of inpatient treatment, it's really nice to be inpatient and away from the world, and that's when the good work happens. But inevitably you're going to come back home, and real life triggers are going to be there, and we're there to kind of help you build the toolbox to deal with that stuff and prevent relapse.
Because this is a process, obviously. You don't just get out of your inpatient care and just everything is done. There is obviously the follow-up that requires for prolonged treatment.
Absolutely.
Yeah.
It's so important.
And you have two facilities, one in West Springfield, one in Southborough, which is about an hour away?
Yep.
Yeah, okay.
Yep.
So central western Mass.
Exactly.
Okay. And Haley, what do you do? What is your role?
So I am the clinical director for both facilities, and I oversee, I'm the program director of West Springfield.
Okay.
So we have 10 clinicians between both locations. So I case conceptualize with them, with all the clients that we have with both locations, and we kind of decide what's going to be best for each client. Everything's very individualized,
Very personalized, yeah.
and so we just walk with them through their journey.
How long have you been in this field?
So I've grown up in and around the field my whole life. My grandfather actually got sober the day I was born. So
Wow.
So I've been in AA meetings as long as I can remember. And then I really got into this field professionally, aside from like helping him with evals and visiting treatment centers, but in 2020. And then I moved to Mass about a year ago.
From where?
From Florida.
Wow. Who would ever think of doing that?
It's very cold here.
Yeah.
And so I happened to find Northstar, and it's really worked out. Everybody really cares. I think that's what really sets us apart, is every single person that works there genuinely cares for the clients, and most of our staff is actually in recovery themselves. And so that's something that's really
They
unique
certainly,
as well.
one, can relate and can understand what's happening, and I think your clientele, I guess, certainly can relate to that. Okay, they understand.
Right.
And I stopped by there a few weeks ago, maybe a month ago, and I just walked in on an appointment. Everyone was so nice. They're really great people. You got the few I met.
Yeah,
Great staff there.
Everybody's super warm.
Yeah. Very nice, welcoming. Yeah.
And happy to be there.
Yeah.
Which is
Yeah.
really nice.
Right. That makes a big difference. Yeah. And so, since you can remember, you've been exposed to this. Yeah.
Yeah, forever.
Yeah. It's your destiny.
When I got into the field, I was like, I think I've just been around addiction and substance abuse for too long. So I'm going to work with children and families instead. And I just happened to keep like falling into substance abuse type positions. And I was like, well, let me just latch on to this and I'll just run with it. And so that's kind of what's happened. And it's taken on a life of its own.
Yep. And Kayla, you've been into this for 5 years now.
Yeah.
And what brought you, and is this something that you've always wanted to do, or did you end up in this field by some other reason? How did you find yourself into this field?
It's so funny because when I was growing up, I would always tell people like, I want to be a social worker. And then, I took advice from a certain person. I ended up in business school, which was great. And then I was in the business field for a while. And then, like most of us, we have, I have personally people in my life, people very close to me, personal experience with addiction and recovery. And it was just kind of like a perfect alignment. I had been in, my husband and I found ourselves in Portland, Maine, which has like a very, very strong recovery community. So there's not a ton of like actual treatment out there. But what happens is when people get sober, they go to Portland, Maine after. There's a lot of sober houses. The meetings are very good out there. And we happened to be there, and I found a job. It was kind of like a business development role within a substance use disorder company. And so I was like, this is actually pretty perfect. And I could relate to, some stuff. I brought some experience in that realm. And ever since then, I mean, it was like fate. It was just kind of like a mixture too of the best of two worlds. And so that's kind of how I ended up here.
Yep. And that is common, right? When you have a family or friends or people you're close to involved with that. I don't know if that's mine.
I'm sorry, that was mine again.
But that's common. In fact, even in my family, we've got addiction, alcoholism, and what I've learned is it's hard to find a family who has not been affected by this. So really, no matter where you look, no matter where you reach, you'll find it, And I think you said something earlier about people becoming more willing to talk about it because the stigma that obviously still exists is starting to relent a little bit. Do you feel that way too? Yeah.
I think so. I think more and more people are willing to seek help and ask for treatment because, I mean, addiction in and of itself is trauma.
Yes.
And so people talk more about trauma, and so I think the more it's widespread and okay to talk about. Addiction is kind of becoming the same.
Yeah, and I think in many cases, and you can certainly say more than what I know, but in many times, the majority of times, the addiction stems from trauma, right? Would you find that that's the case the majority of the time? Yeah.
So what happens is it's cyclical, because people experience trauma and then they feel pain and then they use to numb the pain, and then they start to experience addiction-related trauma, and so it becomes like layers upon layers upon layers, and so they really need help to get through all of those layers.
Yeah, it's not easily done.
Right.
It might be easily said, but it's not easily
Right,
done.
right,
It just takes a long time to do that. And speaking of trauma, too, because I know we said earlier that you have a master's degree in social work, so you, and with your family experience, you've got some in-depth experience here to draw from. But also, you are EMDR certified. So, and this goes right from the great segue from the trauma into the EMDR. And again, the EMDR is eye movement desensitization reprocessing.
Right.
And do you want to talk a little bit about that and how that relates to trauma, and how that type of therapy helps people through trauma?
So what happens is when we experience trauma, I kind of describe it. So like when we sleep, in REM sleep, we have like a brain librarian that comes out and kind of puts all of our memories in order as if they're books. And so our memories, we get ready for the next day. We do all the things in our brain when we sleep during REM sleep. But when we have trauma, it's like an exploded book, and your brain librarian really can't figure out where to put it. And so we can become stuck. And so depending on what the trauma is, sometimes we develop these negative thoughts about ourselves, like I'm unsafe or I'm not good enough.
So with that, not to interrupt you, but you made me think of something. So if something is stuck there, often a memory, a trauma can be altered or amplified.
Right.
And then it's not true, because it's believed to be true, but in a larger sense,
Right.
or amplified into a greater event than it really was. Is that true to some degree?
So
Yeah.
because they can be like put in the wrong place, because your brain librarian, so to speak, doesn't know where to put it.
Yeah.
You can become hyper vigilant in situations that it really doesn't make sense, or things that are not necessarily related can trigger that other trauma. And so, like you said, you can become amplified in situations that wouldn't necessarily cause an amplification. It can be like an incongruent response to small situations.
Okay. Now you talked about REM sleep. REM
Right.
stands for rapid eye movement.
Right.
Right. So, which you're not aware of, obviously, when you're sleeping. And then because the EMDR is the first eye movement. Now, how does REM and EMDR relate? And with that, how does that process tie into each other? How does it work?
So with EMDR, I mean, it started out with, like you said, the rapid eye movements. So it kind of emulates REM sleep in that. And so it gets both sides of your brain online. So we have our logical side, and then we have our emotional side. And so because it engages both sides of your brain, it allows you to fully process memories, traumatic memories. And so, but it doesn't necessarily require rapid eye movements, because you can also use different types of bilateral stimulus. So like I personally use tappers. So like it'll buzz on both sides of your hand. As long as it goes across the midline, you're able to engage both sides of the brain and process.
And I was reading too, sometimes it's following something with your eyes, and which, again, somewhat mimics the REM, right? And triggers stimulates both sides of your brain. And with that, it I don't say alters, but it reprocesses, right?
Right.
That memory, that trauma. And when you're doing that, I guess my first question would be, well, what if a memory, a trauma, is buried? And often I think there's people who just don't have any real memory of a trauma because it's buried. It's sealed up, so to speak.
Right.
And this triggers it and brings it back out. Is that a undesirable effect of this treatment?
So I think sometimes our brains, they repress things that we're not ready to process,
Yeah.
or, it's not uncommon during EMDR if new memories come up. But typically, like, our brains are so fascinating because my intent is never to try and bring up memories that our brains have repressed, because if our brains have repressed it, then
There's a reason.
right.
Yeah.
And so that's never the intent, but sometimes it does come up, and then we just process as we go. We continue on that target sequence plan is what it's called. And so it's not uncommon, though, because most things are going to trigger that specific negative thought about ourselves, because it's almost like we're running in circles and we become stuck. So until we can get a more adaptive or a healthier thought online, we're going to continue to fall into the negative thought. So it's with the reprocessing, it's like, how would you rather feel, as opposed to I'm unsafe, I survived.
How is this different from, well, two things. One, how is it different from normal therapy, and how is it different from hypnosis?
So with hypnosis, it does not put you in any kind of state of hypnosis. You're fully...
See, I think
awake.
hypnosis is more of a guided relaxation, right?
Right.
And so but you're also put in a relaxed state so you can actually feel comfortable. But you're not going that deep
Right.
as hypnosis.
Right.
Okay.
You're fully in control of your faculties.
Okay. All right. And why I mention this is, too, because if somebody was a little skeptical of this
Right.
treatment, because I'm sure there is some skepticism, is there a reason for anybody to be afraid? So, I don't want to go under that kind of treatment. Is you're never in that state like you are in hypnosis. And so what is there to be afraid of if somebody's about or thinking about this type of therapy?
So with the reprocessing, it takes a while before you actually get to that phase of EMDR, because a person they've got to be pretty stabilized and able to emotionally regulate, because the last thing that I would want is somebody to walk out of the office and become, flooded with emotions,
Right.
and without the ability to contain those emotions outside. So we do a lot of grounding type work to lay the foundation so that we can contain it. We actually, it's called the container.
Okay.
But there's a lot of different grounding things that go into it before we ever get to the reprocessing.
Mm-hmm. And it's different from, a lot of that seems like it might take place during normal therapy, right?
It could,
but
yes.
What makes the EMDR a little different then, and what techniques do you use to make it different than normal therapy?
It's not really talk therapy at all.
Okay.
After we identify what we want to focus on, what negative thought, then we do, they're called sets, different sets of, eye movements or other types of bilateral stimulation. And so like the pulsar, so it'll go, back and forth for a while, and then we'll do the set, and, I'll say, what do you notice?
Yeah.
And then they tell me what they notice and say, okay, well, let's go with that. Let's keep processing. And so then we'll kind of do a debrief at the end of session, but it's not a traditional talk therapy at all.
Okay. And you're looking at a couple things, their thought process, their emotions, what do they feel physically?
Right. Where do you feel it in your body?
Yeah.
Like, where's your body holding on to that trauma?
Okay. And you're finding this pretty effective, though.
Definitely.
Yeah. And is this new?
It's actually not. So I want to say I'm sure it's been around a lot longer than the 80s, but it really started to take off probably in the 80s. I say take off, it's just now probably becoming more mainstream. But I know in this area specifically, I don't think that there's very many EMDR therapists around here.
And if somebody wanted to find out more about this, could they call you?
They can
Okay.
definitely
Yeah.
call me. Also, so the EMDRIA website, EMDRIA, is the governing body for EMDR certified therapists, where
Okay.
you can, people that have gone through the specific trainings, and there's a lot of information on that website too.
What kind of conditions or problems can EMDR help with?
Oh, a lot. I think initially it started off with trauma, but there's phobias, addictions. There's very specific protocols for addictions, and even decreasing cravings and urges.
Depression.
It can help with depression, like because there's negative thoughts associated with depression. So if there's any kind of negative thoughts that a person has, EMDR can help target those.
And a typical, not to dive into the weeds here, but I think I'm trying to get a sense of this too. One, how long would a typical session last, and how long would the duration be of a treatment over time?
So EMDR, it's very fast. So a session is like a normal hour session. I know that there's some people that do much longer sessions, but typically I've always done it in my normal 60-minute sessions.
Yeah.
But I've seen a person process really big traumas in one session. Some people take more if there's some, guilt and shame kind of complicating the processing. But it's just, again, it's very individualized to the person. And
so it can be as little as one treatment, but more likely you want to follow through to make sure that it's having the intended effect.
Right. And the processing part of it can be as little as one treatment, but because there's the groundwork that's laid, there's going to be several sessions leading up to the processing of that. And
what can people expect if they go through this treatment? What is their expected result or outcome?
Well, especially after the first processing session, they can probably expect to be exhausted because it can be emotionally draining. But I always tell people you can continue to process for 24 hours afterwards. So you may have dreams. You may these are some things that can happen, which is why the resourcing in advance is so helpful. But people notice very fast progression once we get into the processing of it. Okay,
it's so interesting. Very interesting stuff there. And now you guys, I say that plural, but how many people do the EMDR treatments besides yourself?
So we actually, we have another clinician in Southborough that she's trained in it, and so she's started doing it now as well. And so more and more we're hoping to get additional clinicians trained. But one of the things that I think I'm most excited about, so I recently took a training, it's group EMDR. And typically it would be, they were using it for a group of people that had experienced the same trauma. So you may have to stop me if I get too much into. I'm gonna nerd out here for a second.
Go ahead. We're all ears. Yeah.
But they just released a book on different group protocols and how you can almost create protocols for specific things, because there's very little research in group EMDR in the addiction field. And so I know it's something that I've been talking about for a while, is really wanting to incorporate how can we address multiple people at once, and whether it's decreasing cravings and urges or just the guilt and shame that they feel associated with their addictions, or there's so many avenues to go down, and we have such a strong foundation because EMDR has so much empirical data.
And again, it's not new, but it's relatively new to the community.
Right.
Because a lot of people don't know enough about it. But if it can be done in groups and you can find that's effective, I'm going to ask what's going to seem like a dumb question, because this involves a licensed, certified therapist to do this with. You cannot just do this at home.
Right.
By yourself.
Right.
It's not like here's a CD, listen to this and you're good.
Right.
It doesn't work that way.
No.
Okay, so there's more to it. And I think that, so if somebody wanted to, one, find out about it, and you would try to say, look at, there may be some, and there may be anxiety about any type of therapy, right? If you're about to start therapy, it's a little, it triggers some anxiety there,
right.
No matter what you're doing, whether it's hypnosis, normal therapy, or EMDR. But what can you tell people about relieving the anxious feeling about starting a therapy such as this, and how can you relieve that type of skepticism or any related controversy that they might have heard about?
So I mean, I just think that in any kind of treatment, there's really an egalitarian relationship between the clinician and the client. So we're equals. And at the end of the day, as a client, you're steering the ship. So if you're feeling uncomfortable or you don't want to do something, then that's their choice. Like they get to decide, like, if they're ready to process, if they're not, if the speed at which they want to process, if they want to really ease into it. So that's something that they get to do. Like they get to control if, when, and how. Like I would just encourage everybody to know that they have a say in their clinical treatment.
And I just want to note too, so like as we talk about integrating EMDR into a group setting, just wanted to note that this would be done in small groups for people that are stable in the right place. Like what makes Northstar unique, I think, is that like Haley does have clients, and we have a couple in Southborough that we offer EMDR to. It's not like everybody gets EMDR. She has a few, and they've been with us for a while. They've gotten to a certain point where they're in the right place to do it. And then obviously being able to offer that in a substance use treatment center is very unique, because like we were just saying, a lot of those issues stem from trauma. So we feel really grateful to have Haley be able to do that. But as far as the group stuff goes, it's not like we're just going to go into one of our groups for the day with the whole census and run an EMDR session. She's going to be handpicking people that are in the right state, and it'll be a smaller group, and that's how it will go. So.
And I think obviously relieving that trauma goes a long way towards getting someone out of addiction.
Right.
And you're finding that's really is really effective towards that goal.
Right.
Yeah.
But if somebody, it would be just like if somebody went to the hospital and they had a blood infection, but they were actively bleeding. You have to control the bleeding before you can treat the infection. So you have to control the addiction before you can treat the underlying causes.
Right. Otherwise, it's a mess.
Right.
It's a process.
Because when somebody's active in their addiction, they become emotionally stunted, so they're stuck right there. So you can't really process heavy things when people are active in their addictions.
True. Right. You've got a lot to overcome first.
Right. But and there are protocols that decrease cravings and urges and not necessarily target, the trauma. It's more of the triggers of it. So which is, I don't want to say an EMDR light version, but it's different. It's just a different target.
Okay. Well, you guys, back to Northstar, where you do all of this. You do it in West Springfield and in Southborough.
Yes.
And I know, Kaylee, we met a month or so ago, whatever, and I learned a lot about Northstar when I told you when I stopped in. But you've only been open in West Springfield for how long now?
We opened at the end of May.
The May. So
May.
6 months.
6 months.
That's it. You've done a lot in 6 months.
Yeah.
You got a full staff.
Yes.
And so if somebody wanted to reach Northstar, there's a website and a phone number. You guys want to talk about that?
Yes.
Yeah.
So if we take self-referrals. So if anybody's interested in the program, anybody can call, and you don't have to be referred from a clinician or a PCP or a treatment center. So you can call our main line for that. That's 888-311-0911. We also have a website. It's www.northstar.com. www.northstarrecoverycenter.com. That's a long one.
Yep.
And we have an online form you can fill out too. And just also too, one thing I wanted to add is that as far as like if you become a client at Northstar, what is included? So it is a mix of group and individual sessions. So you're going to get a full day or a half day if you decide whatever level of care you're choosing to of group sessions, which is great. We have a great group of people there right now. And then you'll also get assigned an individual therapist that you get to meet with. We also have a provider, a nurse practitioner on staff that everybody meets with. So we offer, it's not for everybody, and by no means like is this our this is what we do, but it's available to everybody. We meet everybody where they're at. So we do offer MAT, in-house medicated assisted therapy, medication assisted therapy. So we can provide that for people as well.
Is that like methadone or?
So we actually don't provide methadone, but we do Suboxone, Vivitrol, Sublocade, all of those ones.
Yep.
If you are on methadone, though, you're more than welcome to participate in our program.
Okay,
but we
that's
just
good to
don't.
know.
Yeah.
Yeah.
Yep.
Okay, and you obviously, if somebody were to call you first, and you once you make that assessment, you'll either bring them in, or you work with several organizations throughout the community. You can refer out to what's most appropriate, whether it's detox or wherever, right?
Right.
You work closely with a lot of groups here.
And we also, not only do we offer our in-person, but we also offer a virtual component as well as a hybrid component, in addition to the evening programming, because we recognize that life can be busy.
Yeah.
And so, like Kayla said, meeting people where we're at and being able to be flexible and work with people in different capacities.
Wow. Well, that's great. You guys have a great program there, and I learned a lot today.
Yay.
As
That's
always.
awesome.
But and you could dive into the brain, and you can get into great detail, and it's a little overwhelming, but we may have you back to talk about those things in detail too, once we can absorb all the things you already said. But it's great having you both, Kayla and Haley. It's nice having you, and I'm really happy that you're 6 months in and you guys are going strong, and you got a great program there. And so, thanks for
Thank you so
coming.
much,
Yeah.
Thanks so much. Yeah.
Yeah.
Northstar is, like, they take a different approach, and so that's been one thing that's really cool.
Yep.
And just supportive of all the different creative approaches to treatment.
Yep. Great. So, Northstar Recovery. Thank you both for coming, and thanks everybody for listening, and we'll see you soon. Thanks.
Thank you.